I mean, I see both sides of it, but then you have people that come in with all these medicines that, you know, they were on maybe for 2 months and they got a 90-day supply that second time, and
Right, correct. And it does not apply to the original prescription as well. There's some medications, Prozac comes to mind, and certain classes of medications, those cyclotropics, that may need 14 to 21 days before they even begin to work. So if a person is on a severe depression, you want only a 30-day supply so that you can track that they're taking it correctly.
well, I mean, I'm not worried about year pharmacies. I'm worried about the big chains that we're having problems with.
Understand?
And some of the independent ones. Okay, Representative Hogan.
At the proper time, I'd like to make a motion, Madam Chair.
Okay, I've got a Representative Henson.
I'd like to second the motion.
Okay, that's Representative Hawkins.
My pharmacist is already doing this on HP medications and all, so has he been breaking the law?
Essentially, yeah, in Georgia, he's been.
That's crazy.
But of course, the board and the
Yeah.
PBM would have to come back and pull it back. But if what you have to do to get around that is typically, and it wastes a lot of time. You've got to call the physician to make sure that you get approval, and
Right.
that's probably what he's doing, and you might not know it.
Right.
He's
Well, that's a
called.
good bill. Thank you.
Yes.
Appreciate it.
That's all the questions from the committee. Mag, I know y'all have worked on this. And my question was before you got here that the physicians don't mind writing just a 30-day supply. Will they know to do that if that's all they want?
We will make sure that we get some education out to our members and physicians at large. And we're very thankful for the amendments that have already been made to this bill, and thankful to Representative Stevens and everyone else involved for taking into consideration some of the concerns we had when we started with this bill.
Okay, thank you. Is there anybody else that wants to speak to the bill? Nobody else? Okay. All right, we're ready for your,
Madam Chair, I make a motion to pass.
okay. Do I have a second? Second. Well, Michelle, you want to add your second?
Second the motion.
Okay, I have a do pass and a second on the substitute to House Bill 791, that's LC 33829-3S. Is there any other discussion from committee members? And for the two ladies that were late, this is the pharmacy bill. MAG is okay with it. They've worked it out to an agreement. All right. Hearing no discussion, everybody in favor of the passage of the substitute to House Bill 791, say aye. Aye. Anyone opposed, no. Okay, the ayes have it. Thank you, and safe
Thank you,
travels
Chairman.
home.
Thank you.
Now, okay, our Senator Kirkpatrick.
Thank you, Madam Chair. I'm here to discuss Senate Bill 345, and time is of the essence with this bill, which I will explain. I have two people with me. I'd like to introduce Dr. Ike Reichert, who's the president and CEO of Must Ministries, and hopefully he can have a minute to speak when I finish presenting the bill.
Sure.
I also have Megan Andrews from the Department of Public Health
Okay.
here, who in the Senate committee went through an exhaustive line-by-line review of the bill, which you guys are welcome to listen to if you want to, or I can just summarize. So the bill,
No, do not read it line by line.
Thank you.
Senator.
we're calling it the SOS Save Our Sandwiches Bill. And what happened is last spring, a large nonprofit that serves 7 counties in Georgia, Must Ministries, had an issue arise during a routine county health inspection that resulted in their summer sandwich program being shut down. The program had been operating for 24 years, feeding thousands of hungry kids during the summer and school breaks when many of them did not have access to food. The program had not had any issues during that time, but our current food safety laws did not technically allow them to operate the program. This resulted in the charity having to raise an unbudgeted $250,000 to buy sandwiches last summer. Over the last 9 months, I've been working closely with Governor Kemp's office, as well as the Department of Public Health, the Department of Agriculture, since both of them have jurisdiction over food safety in Georgia, and Governor Roy Barnes, a member of the MUST board, was also helpful in this effort. This bipartisan bill, crafted with input from DPH and Georgia Department of Agriculture, strikes a balance between public safety and the needs of hungry kids in our community, and it allows nonprofits that follow basic food safety procedures that are already in law to operate these summer feeding programs in a safe manner. The meat of the bill, so to speak, is in lines 127 to 132 and 146 to 147, which basically allows the nonprofits to operate this program for a 12-week period during the summer and an additional 4 weeks during the year, and to deliver the sandwiches to locations like apartment complexes and trailer parks. It allows the sandwiches to be prepared in church kitchens, provided basic food safety measures such as proper hand washing, gloves, etc. are followed. It does not allow food to be brought from home. I would urge for support for this bill that's important to so many disadvantaged kids and for the volunteers that are trying to help them. And I hope that Dr. Reichard would have a moment to speak.
Thank you. First of all, I appreciate you giving me your time this afternoon. MUST Ministries has been doing the summer lunch program, as the senator told you, for 24 years. That's over 3 million meals that have gone out as a sack lunch, and we've never had an issue with even one of those through the years. But because of the certified kitchen aspect, it threw things into chaos because it was about 3 weeks before we started. And to give you an idea, each day, that's about 7,000 children a day that we're feeding. We're able to source them through the schools who tell us, you know, here's the neighborhoods, the trailer parks, the different areas where there's children with great need. And this is a mobile opportunity. We go out to them with transportation being such an issue. And so we launched the Save Our Sandwiches campaign, and we were very fortunate. We were stunned by the response. And for us, there never was an issue of whether or not we were going to feed those children. We were going to feed those children. And we were just delighted that the community stepped up the way that they did. And as I go around and have the opportunity to work with the different school systems, what we know is about 1 in 4 children in the state of Georgia are food insecure. And so one of the things that we do on an ongoing basis is we have 39 pantries that we place inside of schools that are there year-round. But this is a program that helps that 10-week summer break, and we're looking at ways, and this bill allows us to do it, to be able to also take those fall breaks, winter break, spring break, all of those. So we're just appreciative to you to give us this opportunity. And I want to leave you with one quick story if I can. I'm a minister, so I've got to tell a story, all right? And or take an offering. I'll give you all a choice, whichever one you want to go with. But we at one...
A quorum, you want to see him leave, you call for an offering.
It's going to be tough. Well, we were at Green Acres Elementary School. The principal there is Ashley Mize. Her dad is Max Bacon. It was mayor there in Smyrna. And Mrs. Mize, we were getting ready to cut the ribbon, and she started crying. And she said, "Let me tell you why I'm crying." She said, "A few weeks ago, I had a child come in at the beginning of school that morning, found me in the hallway, and she said to me, 'Miss Mize, can you get me something to eat?' And she said, 'Well, honey, did you not have breakfast this morning?' She said, 'No, ma'am, and I didn't have any dinner last night.' And Ms. Mize said, 'Well, why didn't you have dinner last night?' She said, 'Because it wasn't my turn to eat.' And it's stunning to know there are situations that are like that. And so that's why the food pantries, and we hope we expand that even much more. That's in a 2-county area that we do those right now at Marietta City Schools. But this goes over an area of 7 counties. And just thank you for helping us get an answer.
And I have one of the schools in my district, Powers Ferry, that it has a food pantry, and it's made a great deal of difference to those children in that area. And I will tell you, I went to get some shots at the public health right as this started and made a impromptu start with the health director and got the whole spiel about why we couldn't fix sandwiches anymore like you had been doing. And I was glad Kay took it over and ran with it and got this solved for us. It's, I mean, when you've been doing something for 40 or 50 years and you haven't had any sickness from it, I understand rules, but this was one example. Sometimes government just needs to get out of the way of people helping people. So, Representative Silcox.
At the appropriate time, Chairman Coover, I'd like to make a motion to pass.
Representative Henson, pardon? Okay, got it.
Thank you, and I support you, Bill. I support what you're trying to do. Why, we're saying it can't come from home,
That's correct.
but it can come from church kitchens. Why are church kitchens are they being inspected? Are they being this, that,
Yes.
or whatever that we're saying this? I'm just curious. I mean, this has nothing to do with,
They can come from other commercial kitchens as well. It could be a restaurant that provides their kitchen. It could be a business that has a commercial kitchen. It's just that.
And it could be from a synagogue, right?
Sure, it could be from a synagogue. Any place that has a commercial kitchen that is following basic food safety rules that are already in the law, it accommodates for that. But with home kitchens, it's a little bit harder to know what you're getting, and that's really what started this whole problem. And I really appreciate the Department of Public Health working with us to find something that is going to help not only MUST, but the other nonprofits in the state. And the reason that it's time sensitive is that school's going to be out May something, and they've got to get their program operating again. But thank you for the question.
thank you.
I mean, the problem started because a lot of people would make the sandwiches at home and bring them in. They would make lots of peanut butter and jelly sandwiches and what other kind of sandwiches and bring them in. And, you know, and I, being a nurse, I understand, and Kay's a doctor, about how important hygiene is, but sometimes when people are going without food or eating out of garbage cans, a sandwich made at home that might accidentally have in my home, it would have a corgi hair in it. I don't think it's gonna be as bad as eating out of a garbage can or going without, but then, like I say, I'm very appreciative to the department to working out a compromise, so at least you can continue your work. Representative Dempsey.
Yes, thank you. I want to say thank you. Thank you so much. And thank you, Dr. Reichert, for all the work that you do. Familiar with it, and I appreciate it. Senator Kirkpatrick, thank you for bringing it. I was just noticing it, that I think in the language, maybe on page 3, it doesn't say churches, it says institutions. So is that what we're talking about, just in
Exactly.
general? I know, and talking about it, it says churches, but there's opening for lots of good places for this work to go on.
Absolutely.
Yeah, great. Well, thank you.
We at MUST, the safety guidelines that are recommended in the bill, we were already following all of those. It was just preparing sandwiches in a home and then bringing them to a hub site where they were distributed.
Well, thank you. I know you'll make it work.
So, all right. Okay, there's no more questions? Okay, do we have anybody from does Public Health want to pipe in?
No, I'm just appreciative of Senator Kirkpatrick and glad we worked this out. We're supportive.
Well, I mean, it sounds like it's sort of fun with SOS, Save Our Sandwiches,
It'd be hard not.
but it's really important when people and children are going without food that they find a way to get the food to them. And so this is a really important bill.
The substitute sandwiches, not nearly as good as a homemade, were 89 cents a piece. And when you're talking about 7,000 a day, that was kind of staggering to us to realize we had to replace that. And so again, the generosity of people, it would make you proud of your constituents.
Well, and that 89 cents a day would add up, that could be used to stock food pantries with the staples that would feed a whole lot, would fill a whole family. Not just one sandwich for one children, but would feed the family, so it made a difference. Okay, what's the committee's?
I make a motion to pass, please.
All right, I have a motion that do pass. Do I hear a second?
Second.
Okay, I have a motion and a second on the passage of Senate Bill 345, that's LC 338215S. Any other comments from the committee? Okay, hearing none. Everybody in favor of the passage of Senate Bill 345, say aye. Aye. Anyone opposed, no. Okay, there we go.
Thank you, Madam Chair.
Thank you, sir, for all you do for our community. since it's my community too. And I'm glad they finally got you the variance.
Yes, ma'am.
They're building a new facility and needed about, what, a 12-foot variance or something?
30 feet.
And so that they could have a wing, this right, for children, mothers and children that are a little bit separated from the other area. And it, here again, was a constant battle on zoning laws, even though it really was not. There was a wooded area behind it and all.
About 80% of the people we serve are women and children.
Children.
Suburban poverty has some uniquenesses.
Thank you. Okay. All right, I guess I'm up next. And for the last one, is that it? Is that the last one coming up? Okay. You know, for 50 years, and this is on House Bill 1054, it's screening for newborns. Okay. For 50 years, we have been screening, public health has been screening for various diseases on newborns that either could cause debilitating, life-threatening, or really life-destroying disabilities if they're not caught quickly. And certainly as medicine has evolved, we're finding more and more ways to, when we find these diseases, these rare diseases, to interact with them in such a way that they do not cause the debilitating damage that they've done. And today was the National Rare Disease Day, so it's appropriate that we're having this. The FDA process to approve a drug is sort of the same process that HSS, you know, or that they go through to decide which childhood genetic and problems they are born with should go on a list of things that can be screened and where there's an intervention for it. And over the years, we will come back and we will add diseases to the list that should be screened. We added 2 in 2005, and one as far back as 2013. And they are not screening for them yet. That means that some children in the state are now either mentally or physically or emotionally, it's mainly physically and mentally debilitated and will never function to the capacity they could have had a simple screening test been done and medical intervention started as a newborn. So what we want to do is we want to speed up our state government's process to screening children for babies, for newborn babies, for these newly added diseases. So what it does, it makes a newborn screening advisory committee that it's currently in rules, but it's codified. And this committee is specifically charged with, within 1 year of a disease being added to this list, with studying and providing the commissioner with a recommendation to include estimated costs for the implementation of the newly added disease. The committee may also take applications of other ones that maybe are not on the list from the feds. And what it says is that once the commissioner receives the recommendation, he will be tasked with submitting a budget if he agrees with the severity of the fact that the disease is a major problem. It can be dealt with intervention. He would submit a budget request to the General Assembly for appropriation funding in the following year's budget. Doesn't mean we'll get it, but at least it has to come up for consideration. And for all of us as legislators, and the ones that serve on the Appropriation Committee, to have a chance to decide if they want to put money toward preventing these terrible childhood problems, diseases, and to, intervene early. So that's what the bill does. And I'll be glad to take questions. And I'm sorry I'm getting hoarse and I'm tired. It was a big day. I went off to Walmart this morning to make sure that they honor our doctor's prescriptions. And I'm just telling you, I'm on a roll. Don't go to Walmart to get your medicines filled. Because they're not filling them under certain circumstances, and they won't tell us why, and they're perfectly legal in the state of Georgia. Representative Silcox, I told you I was on a roll.
Isn't it true that Chairman Hawkins brought a bill to this effect about Crab's disease a couple of years ago? Mhm.
That's right.
Crab
Are
A,
they being
excuse me,
tested
I'm
for it yet? Do we know? Are they being tested for it?
Yes.
Okay. But we still have several that haven't been. Okay. So, thank you. Okay, Representative Hogan.
Up time, I'd like to make a motion.
Okay, thank you. Anybody else? Is there anybody from the audience that would like to speak to it? To the bill? Okay, no? All right, I'm ready for a motion?
I'll make a motion to pass.
Okay, we have a motion of due pass and a second for House Bill 1054 LC 33A320S. Everybody, there's any more discussion from the committee? Hearing none, okay, everybody in favor of the passage of the bill, say yes. Yes. Everybody opposed, no. Thank you, the bill's passed, and we are adjourned, and you can go home. Be careful on the roads, everyone, and we'll see you next week. And huh? Oh, that's right, we're doing regulated. Oh, yeah, we're doing regulated industry.